Let's bring in Dr. Frank Cantacessa. Doctor is with us now. Can you tell us when we might hit peak Omicron?
I think we're approaching it, Stuart. You know, if we look at the pattern that we saw in South Africa over the last month or so, they peaked after about 2 or 3 weeks, maybe 4, and then you started to see a dramatic downswing. And I think we're coming to that point where we're probably hitting a peak pretty soon. They actually lifted a lot of their COVID restrictions in the last couple of weeks as they've hit the downswing. So I think we're getting there fairly soon.
That's very good news, isn't it? Because it spikes and you're over it relatively quickly. I call that good news.
I think it's very good news. You know, if you compare that to the Delta surge, which we really started talking about in the beginning of August, and it really was with us pretty much until about Thanksgiving time, when we started to talk about Omicron. You know, that was a several month of really more severe cases, and Delta hit us pretty hard. And Omicron, I think, is going to wash over us a lot faster, with causing very little damage and much milder symptoms. And that is holding. You know, there was some question initially of, well, you know, the rest of the world is seeing milder cases. It remains to be seen if that's going to hold true here. And so far it is. We're really not seeing severe cases, you know, here in the U.S.
I'm confused here. Last week, the CDC shortened the quarantine time to 5 days, no test to get out of it. Now, Dr. Fauci says you should be tested to get out of that quarantine situation. That's confusing. What's going on here?
It is confusing. It's confusing to the public. It's even confusing to us doctors. I had to read the guidance a couple of times over before I understood it. So it's enormously hard to understand. The testing to get out of quarantine or isolation is a terrible idea. The PCR test can remain positive for weeks, even months after a positive case. The antigen tests, the home tests, are less reliable, and they're in short supply. Even if the government comes through with these hundreds of thousands of kits that they're promising, the kits are still in short supply. My patients are having trouble finding them. And then to have to use the kit to get out of quarantine. So now you're testing to go into quarantine and you're testing to go out of quarantine. That's doubling the number of tests that are going to be needed. And I think that's just going to cause more confusion. Also, you can have a false positive test on these kits with other strains of coronaviruses like the common cold. The common cold is caused by other coronaviruses. So you can have just a regular cold and test positive on these things.
That's just such a mess. And here's another one for you. Rhode Island is allowing COVID-positive healthcare workers to continue working if their facility is facing a staffing shortage. That's a complete retreat, isn't it? I mean, they haven't got the staff to run the hospital, so you let in the COVID-positive people. That's a complete retreat.
It's a complete retreat. I think the public is sensing that we're a little bit lost in the forest here. You know, watching them scramble to try to change these rules, it reminds me of sort of like a snowstorm. You know, when the snowstorm is coming, the locality will have a plan in place to try to handle the storm and basically keep the roads clear. But you can't stop the storm. And what I'm sensing from the government is that they're trying to stop the storm instead of just keeping the roads clear, if that makes any sense. They're trying to stop the inevitability of Omicron basically sweeping through the public. And I think I mentioned this last time I was here. We're all going to either get it, come into contact with it, or be exposed to it, you know, over the course of the next couple of weeks. And nothing that the CDC or the FDA does is going to stop it. So we have to manage it better.
Just real fast, almost a technical question. If you've tested positive, right after that, can you get a booster shot? Or do you have to wait for a long time to get the booster shot?
I would wait. I would wait a while. The official guidance from the CDC is that you can get it, and there is a push that you should get it. I tell my patients to wait at least 3 months. And, you know, the data will show whether that's even going to be necessary or not. You know, we hope that Omicron will confer a large degree of natural immunity. Matter of fact, studies are now showing that if you've had Omicron, there is some degree of immunity against Delta. So, and it doesn't work the other way. So if you had Delta, you can still get Omicron. But if you have Omicron, you're probably not going to get Delta. So it's quickly swept Delta off the map. So I would, number one, I would not encourage boosters right after you've had COVID. I would wait a while, if at all. And the good news is that Omicron is showing sort of like a retrograde immunity towards the prior strains, and that's really good news.
I'm still a little confused, but nonetheless, you did your best to straighten me out, Dr. Frank Contessessa. Thank you very much for joining us. You'll be back soon.
Thank you, Stuart. Happy New Year.
Yeah, thanks very much, Doctor.